Doctors say a drained abscess is a cured abscess. What does that mean? That once an abscess is drained, it's practically cured. And we've seen it, for example, with some pimples, right? That as soon as it pops, well, it doesn't come back again. We see it with other types of abscesses. However, friends, with teeth, it's not like that. And I'm telling you this because many times we've had patients who are told to drain the abscess, and that once it's drained, well, it's cured. And unfortunately, with teeth, it's not going to work that way. And I'll explain, as always, in terms you can understand. When a tooth gets infected, it basically starts to swell down where the root is. This infection starts to grow, and when it's too big, it destroys bone. And when it finds a way out, which is fortunately a good thing, especially when it comes out through the gum, because it can go back toward the tongue, and that's complicated. But when it comes out toward the cheek, the part we can see, it often looks like a pimple, and the patient says, "Oh yeah, I have a pimple, but I squeeze it, it pops, pus comes out, and that's it. It stops bothering me for a while." And it makes sense to a certain point because they say, well, it doesn't hurt anymore, it popped, it's cured. Why? Because the pressure was released. But there, unlike the skin, for example, where a pimple pops and then the immune system starts doing its thing and ends the infection, there we have a tooth that's infected, and an infected tooth can't be treated by the immune system, not even by antibiotics. Antibiotics and the immune system help that inflammation, that infection to decrease. However, the treatment absolutely has to be either an extraction or a root canal. Why? Because the simple act of popping the pimple or pricking it so it bursts, it comes out and releases that excess pus that's in there. However, the tooth remains infected. And remember, friends, teeth have a pulp inside, a very thin nerve, and no matter how much we want to give antibiotics, it won't get in. Physically, that antibiotic won't get inside the tooth, so the infection continues. Therefore, the only option is to remove that infection mechanically with a root canal or an extraction. So if you have a dental infection, a pimple, or pus appears, and you think that by popping it, it's treated, or taking antibiotics is enough, we're very wrong, and we can put health at risk. Because a phoenix abscess, which is the typical acute abscess, right? That was already chronic and became acute. It can be much more complicated because it can already have new different bacteria that are already resistant to the antibiotics you already used for that infection. And that's why it's important to do a comprehensive diagnosis, because if you have another infected molar over here and they never saw it and they're treating this one and they gave you antibiotics for this one, they pulled the tooth for this one, but this one over here also has an infection, they're also creating bacterial resistance in this spot, because if you didn't do anything to this tooth, we're going to have problems there later. The topic goes much further. If you're interested in more